They're the model for care, serving almost 10,000 patients a year and providing 24/7 quality care. GBMC is the go-to for pediatric services, and here to tell us more about them is Dr. Laura Scott, Director of the Pediatric Emergency and Inpatient Unit at GBMC. How are you?
I'm good, thank you. Thanks for having me.
So we had a lot of good giggles off camera.
Yeah.
I just love your energy, by the way. So let's talk about exactly what you do and why it's so important, you know, to go see your pediatrician.
Yeah, so I'm a pediatrician in the emergency department, which means that I see children who come in for emergent needs, which is different than kids who go to see their pediatrician in an office or in a clinic. Many parents, I think, struggle with when do we go to the pediatrician for a need and when do we go to the emergency department. It can be a little confusing because we are also pediatricians. So I think that's what people struggle with, is where to go when and what to know.
So when do we go? What type of injuries do you see?
Yeah, so the injuries that we see are typically a lot of things: broken bones, bones through the skin, icky things, bleeding that won't stop, falls from significant heights, significant burns, bites from animals, things like that. Those are the injury type things that we see.
Gotcha. And how does the care differ from the ED?
So we might have some resources in the ER that a pediatrician doesn't have in their office, or some that we can just utilize a little faster than the pediatrician could. So imaging of a broken bone, of a belly, of a chest, imaging of the head if a child were to need it. IV fluids is a big one if a kid's dehydrated, something that just medicine we might have that a pediatrician might not have access to.
Gotcha. So let's get into a little bit detail. When should we go to, see our pediatrician? Those signs.
Yeah, so I think what's helpful to know is that you should have a pediatrician or just a primary care provider. So that could be family medicine, pediatrician, nurse practitioner, physician assistant, that really knows your child and knows your family, so that if you have questions about a child who is sick or an issue that you think they're having and don't know what to do, we think the best thing to do is to call your primary care provider and ask them. They know your child, they know you, they know your family, they trust you, you trust them.
You build that relationship.
Absolutely.
You've been going for years.
Absolutely. And so they really know your history and can give you good pointers about whether or not this is an issue that you can just come into the office for and feel comfortable and see them, or if you really do need to get faster urgent care, emergent care in our emergency department. So that's sort of the first thing I would say. And then reasons really that we want you to come and see us are specific groups. Fever is a big phobia, I think, for families, for moms, for dads to know should we go to the ER or not. Not every kid who has a fever needs to come to the emergency room.
Really?
Yeah, so the kids that we really want to see are babies. So itty bitties, birth to 3 months old, if they have a fever 100.4 or higher, we want to see them in our emergency department. Other kids, if they have fever, they're not drinking, they're not peeing, they're not acting like themselves. Those are definitely reasons you're going to want to bring them to see us in the emergency department.
Gotcha. How about the flu?
So the flu. So the flu is a big...
People
are scared of the flu, and rightfully so. But again, I would say the flu, usually children do okay with the flu. If it's a little bit of cough, some fever, definitely call your pediatrician if you're worried about it. If your child, you're worried that they have the flu and they're not drinking, they're not peeing, they're just persistently throwing up, they're having trouble breathing, those would be reasons to come to the emergency department as opposed to just calling your regular doctor.
Okay, this is good to know. I know you helped some of our viewers right now.
We try. We really want to make sure that everybody feels comfortable and knows that they can get the answers that they need.
Absolutely. So, having that open flow of communication is so important. So how often should we even take our child to go see a pediatrician? Yeah,
so I think, every child should see their pediatrician at least once a year for well-child visits. Itty-bitty kids from birth to the first year of life, they're going to be seeing their pediatrician a lot more. Just make sure they're growing well, they're getting all the shots, vaccines that they need. And then other than that, once a year, just checking in, making sure that everything is going well, so that then if something happens and you have a more urgent issue, that everyone's been keeping tabs on what's been going on with your kid for the last X number of years and would really know the best thing for them.
Absolutely. And GBMC, the staff is incredible.
We appreciate that. We like our pediatric family and our emergency department family. So, and we want everyone to feel very well cared for when they come. So that's our goal.
So if I have a child, like, you would be like the best doctor because your energy is just so Absolutely incredible.
You know, I am a pediatrician.
Yes.
And we love kids, and you know, we love to see all kids, all ages. And if you're concerned at all, we'd be happy to take care of them. So,
yeah, because you know, emergency visits and stuff, that adds, you know.
Scary.
Yeah.
It's very scary, and it's stuff that we see all day, every day. So we're really comfortable with it.
Yeah.
But we know it's so hard when you're worried about your child to know what to do, where to go, who to ask, et cetera, which is why it's really good to have a doctor that you trust, but to know that we're always right around the corner too if you need to come see us.
So good to know. Where can our viewers find more information?
Yeah, so if you go online to gbmc.org, there is a pediatric group webpage that talks about our clinic, physicians, as well as our emergency department and the services that we provide. So it might be able to help direct a little bit too.
Well, thank you so much. This was an awesome conversation. And I'm telling you, energy speaks for itself. So thank you so much.
Yeah, thank you. Thank you very much.
Absolutely, guys. Well, speaking of kids, I'll tell you what kids aren't doing today.